Good afternoon, everybody. Good afternoon, everyone. Hello, good afternoon.
Good afternoon.
Good afternoon.
Awareness webinar today, which is organized in collaboration between the Care University Wellness Center and the Global Outreach Consortium as part of the Breast Cancer Awareness Month. So I am Mrs. Abigail Kwarteng, the Senior Admin Assistant at the Care University Wellness Center, and I'll be moderating today's session. Today we'll be, our webinar is themed Empowering Caregivers, Informal Caregivers, Building a Strong Support System for Breast Cancer Recovery. Yes, so we are by this focusing on how family members, friends, and other relatives who often act as informal caregivers to breast cancer patients can provide the needed support that these patients need in any capacity they may be. Who will be talking to us? And I'll do a brief introduction about them. First, we have Madam Elsie Narh, a nursing officer and breast cancer survivor. She's also an advocate at Medicare Hub. She's going to use, she uses her own journey and professional expertise to support and inspire others. And secondly, we have Dr. Priscilla Vandyck-Sey, a consultant, family physician, and the executive director of the Global Outreach Consortium. The Global Outreach Consortium focuses on providing healthcare access, education, and support to the underserved communities, particularly in areas with limited medical resources. Dr. Vandyck-Sey has dedicated her career to improving healthcare delivery, especially for those who need it the most. And she will bring a lot of knowledge and ideas on caregivers for today's session, which is going to really be of help to us. So today we will look at practical ways caregivers can be better prepared to help with recovery for any breast cancer patients we may be related to. So can I hear a welcome to our panelists for today? Can you welcome them, please?
You're welcome, please.
Okay, so we will begin with Madam Elsie Narh, a breast cancer survivor. She will take us through first her journey, and then Dr. Vandyck will take over. So, Madam Elsie, your audience awaits you.
I'm grateful for this opportunity to be here. The earlier speaker said, my name is Elsie Narh. I am a nurse with the Trust Hospital, Dansoman, Accra, and I'm a breast cancer survivor. I am also the CEO of Medcare Hub. It's a social media platform where I use to do my advocacy and to tell people about cancer and other things like abuse awareness, family life, spiritual life, and all that. So today I'm going to share with you about my journey with breast cancer, what I went through and how I survived it. I have put together some PowerPoint presentation. I hope it helps me. So as we wait for me to set up this thing, my journey started in November 2021. Whilst I was doing my own self-breast examination. And I noticed a painless lump. I noticed a painless lump in my breast. I was taken aback because I know how my own breast feels. and seeing this new thing, I mean, I was like, what is this? Immediately, breast cancer came to mind. But I told myself that until I have gone through everything, it is not breast cancer. So there and then I had just psyched myself that, hey, it's not breast cancer. So I was also willing to go through all the investigations to make sure that it is not cancer. So I noticed the lump, I think 31st October. I was on leave by then. So when I resumed 3 days later, I just went into the wellness clinic to have it checked. Lo and behold, it was a lump. So actually the doctor saw that there was a lump there. I did a breast ultrasound. The first one, so it said that it was BRAD1. It didn't suggest anything cancerous. It was just a benign lump. So, but interestingly, there was 2 large lymph nodes in my left armpit here, which got me alarmed. Though the sonographer said it was nothing, I felt I wanted to know more. So I went on to do a second scan, and the guy said, oh, I think because I was a staff, he couldn't find the courage to just tell me or to print my report for me. So he directed me to the radiologist. Okay, since she was a female, he directed me there to do it. She did this, give me the reports. It was telling me that it was highly suggestive of malignancy, but I was not moved. Like, I was so hoping against hope that I would hear something positive. So the following day, I showed it to my doctor, and immediately she opened it. She just said, oh, Elsie, we are fighting this together. At that point, that was when I realized that my life was at risk and I was going to die, and I began to cry. Then she said, in fact, we all cried together. Then she said, you know what, you would have to know that we are fighting cancer. We are fighting cancer at all costs, and you are going to be there for your children. Even my little one was 2 years by then. So she said, no, see yourself being there for your kid, even the little one completing university, having her own family, or be there for your children. And she said that I am going to go through the length and breadth in my power to make sure that you get support from the hospital. Okay, so that also soothed my pain. I mean, after crying for a while, I knew that, they are going to take care of me. So I just wiped my tears. So that was how my hospitals set in. They came in to help to pay all my expenses. So I did all the diagnostic investigations. I did the biopsy, which confirmed that it was a cancer. I went on to do the CT scans, just everything, all the blood work, and I was good to go to start with my treatment. So I started with chemotherapy. I had eight cycles of of chemo. And before I started my chemo, I had locks on. I had locks like Dr. Vandyck. And I was like, okay, you know what? Let me even interlock it before I even started. So the day before I started my chemo, my stylist came to redo my hair to make it look neater. And I did it. Please, is my screen showing? I think I'm still having a difficulty here. Okay, we can still do without it. So after the session, in fact, my director was there to see me, to encourage me. And after that, my nurse said, you know what, in 3 weeks' time, by the time you come, there'll be nothing on your hair. So my friends was like, okay, why don't we just cut the locks and use it as a wig cap, so that when you eventually lose your hair, you would still have you will still have the wig cap on, which will still look like your hair. So I was staying in Dansoman, went all the way to Laboni to cut my hair. And yeah, so I was like, I was ready to beat this cancer at all costs. I wasn't going to wait for the cancer to shame me before I eventually lose my hair. So I did that, and my hair eventually began to fall off. It fell off by the side. I stopped bathing my hair because all the time you go to the bath and the hair's coming off. So I stopped for a while. Then when I decided to just bath it, in fact, once I put my hand on my head, everything comes off. And I said, you know what, let me just clear this thing once and for all. So I entered the bathroom with a bit of a hair on my hair, and now I came back with nothing on it. All right, so this is me during my first chemo. So I had locks on, it was growing a bit. So a day before this day, my stylist came to relock it for me. So it was looking very neat. And I just told her that I might not redo my hair for a while, so that she wouldn't be calling me when she'll be coming. So this was the 6th of December 2021. I started my chemo. And this is me at the barbering salon. I was so excited. I mean, you know, women, our hair is difficult to lose, for a woman to willingly cut off their hair. But for me, it was an excitement. I wanted to really go through this thing and beat it at core. So you could see the broad smile on my face. I had saved my hair for later use. So 2 weeks later, this is me as I was losing my hair gradually. So at this point, I stopped bathing it. Then a week later, this was what I had on my hair. But I was all excited about it. So I have done the wig cap. I had a series of caps I use when I'm home, so that when I'm going out, I just put them on. And in fact, every hair on my hair was gone. In fact, including eyebrows, including pubic hairs, including hairs on my hands and my feet, everything was gone. So I was enjoying no shaving for a while. And I was like, it's okay. So this is me still bowed. It's still 3 months down the line, still doing my chemo. This was me one day after church, and I just took this photo. So this is my wig cap And when I wear this thing, you would never know that it's a wig cap because they use my own hair with a little extension. So my own hair was to the tip and the extension was from the scalp. And I was good to go. I was living my normal life. I got leave, sick leave from my work. So I was home, and my director said that, we are willing to do everything for you. What we can't do for you is to survive for you. So the only work I had to do was just to believe and to survive. And whilst I was going through this, I told myself that faith and science works together. Um, I had gone through a divorce earlier that year, and when I thought my life was resetting, this thing hit me. So I was already on a path to discover, to ask God for direction, what I should do with my life, because I love ministry and I married someone in ministry circles, hoping that doing the work of God would bring me fulfillment. So I was like, what do I do next? So it was in a period of fast when the diagnosis was made, and I was still in that period of fast, hoping that something miraculous will happen. But hey, after everything, when it was still cancerous, I mean, I felt that God gave me a word that faith and science work together. So if I'm able to put my faith together and I add the treatment to it, I'm good to go, because it is God that gives wisdom to man to come up with all this treatment protocols, drugs, and all that. So that was what helped me in my journey. And I told myself that whilst I'm home, I'm going to dedicate myself to growing my faith more. So now the scriptures was making meaning to me. I could really understand when David said that when I walk through the valley of the shadow of death, I'll fear no evil. I believe when Isaiah said that by his stripes we are healed. So all these things helped me in my journey. Okay. So after the chemo, I had to go for surgery. Okay. So this is me. This is me just after surgery that evening. And you can see my two show. I was just so excited that God had gone with me to the theater and brought me back. And this is me a day after the surgery, just a day. So my surgery was on 24th of June 2022. So this is 25th, just a day after the surgery. And this is me on 26th, still bowed. So you could see the drainage, the drain from my side, just trying to drain off the lymph node, because they took quite a dozen of my lymph nodes. I know lymph nodes helps to drain excess fluid. So now, since there will be accumulation of fluid, they have to drain it so that it will not affect the surgery, because the wound might open if there's a lot of fluid there. So this is me enjoying my cocoa and my kose. Yeah, see me with my swag on. In fact, at the hospital, I was doing my daily reviews. Like every day, I talk about what I'm going through, what I'm doing, and all that. And so after the treatment, after the surgery, I went on to do radiation. Unfortunately, when they took a sample of my lymph nodes to the lab, the pathologist, they said that I still have some cancer cells in the lymph node. So then that required me going for radiation. I had radiation for 25 times. It was it was a 5 weeks duration. But when I started radiation, I had COVID. So I had to break for a while. So the radiation took me like 6 weeks. Okay. And now after that, because my tumor was hormone receptor positive, I was put on hormone pills. That's the tamoxifen. So since I'm still in my reproductive age, my estrogen will still be at peak. So they have to give me a drug so that the estrogen will not have negative effects on my breasts again, so that it wouldn't cause recurrence. So I stayed home for 14 months and still having my salary, still having all the privileges that every staff could have. And I returned back to work January 2023. So this is me at work. My hair grew again, and I began to love short hair. There was no reason why going back to locks again. I just felt like, okay, this is a cool thing. I could still keep my hair short. So this is my advocacy journey. Whilst I was doing my chemo, in fact, when we look at this picture, I I I took it when I had shot one of my YouTube videos. So this was after I shot YouTube, and this was during my chemo days. I had started a YouTube channel called the Medcare Hub. So this is the Medcare Hub. So I started with abuse awareness because I was in a toxic relationship. I wanted to tell people about how to recognize abuse just the way they are. So I started with the Medcare Hub, and later on, I added the breast cancer awareness. And also, this is what I do. So this is my YouTube page. You can find the same Medcare Hub on Instagram, TikTok, and Facebook as well. So this is my advocacy platform. And I'll talk about the Support a Sister to Thrive initiative later. I'm told I will talk about it later at the end of the webinar. So I want to go ahead and talk about the support system I had. So this is my mom. She is diabetic hypertensive with a deformed foot, a charcoal foot, using two working aids. But this woman single-handedly helped me as I was going through my treatment because I was alone. All my siblings were out of the country, and I'm alone here taking care of her while she also intends to take care of me. So me and her were alone in the house, helping me to take care of the kids whilst I was also going through my treatment. And I really appreciate her so much for doing that. And this is also my nurse Jennifer. She was a friend who became a personal nurse. So my director said that, you know what, since you are alone, you are a single mom, we would want you to choose one person among your friends who are nurses so that she could be assigned to you anytime you are going for chemo. So that is how Jennifer became my support system. She would take me for chemo, bring me back. Since the chemo reduces my immunity, I had to be on a shot after 3 days after every chemo. And so she will come back to give me shot. Days that I'm weak, she'll come to attend to me. So this is the support system I had. My employers gave me everything I needed. So they gave me the financial support, they gave me the emotional support, psychological, spiritual support. And this is my doctor, Dr. Ej. She was the first person that I saw. And she took my matter up so personally, so personal. She really went far beyond what a clinician would do. She became like a sister to me. But before then, we were already friends. But she took my matter up to the next, making sure that I had everything I needed. So this is Dr. Joyce Ej. Okay. So this is something small about my journey. This is just some graphics I could show about how I went through my journey. So I finished everything in October 2022, and it's been 2 years. It's been 2 years after my treatment, and I'm on the hormonal pills. I'm going to be on these pills between a period of 5 to 10 years. So this is my second year running, and I'm doing so well with it, with no side effect, with just little side effects. Okay. So that is my journey so far, and I hope to talk about the Support a Sister to Thrive initiative by the end of this webinar. Thank you so much. I hand over my mic.
Thank you so much. Thank you so much, Madam Elsie. We so much appreciate this. It's very inspiring to see you back. And I love your energy. Even whilst you were going through all that you were going through, your energy level was super. So doctor mentioned that we should allow you talk about the Support Your Sister initiative. So if you're okay, or we should let her finish.
I could talk about it briefly. So
Yes.
one thing that helped me aside my faith was because I had the financial support. In fact, it gave me all the assurance to even believe in the treatment. Okay, so imagine I'm now thinking about how I'm going to get money for treatment plus myself thriving through the treatment. It's not going to be easy, but the financial support I had played a key role in my survival. And this year, as I was starting my advocacy, I felt the Lord lay on my heart that, you know what, a lot of women who couldn't survive breast cancer, it's not because they didn't have the mental preparedness, they didn't have enough faith like I had, but it's just because they didn't have the financial support. Because there are people who are in the far lands who don't even have money for transport, even to feed. And they have these lamps with them, and it's either they think it's superstitious or they don't even have anybody to even direct them. And even if they does, the money to even continue. See, even to start the diagnostic investigation, it's not easy. Doing your scans, your biopsies, your blood works, all these things to make sure that they really know what's happened to you. You would have spent close to a fortune before you get to that point, before you even start the treatment itself. So a lot of women who die, who are part of the 50% statistics from WHO, it's not because of it, just because they don't have the financial support. So I took upon myself that anywhere I go, and this year, as I do my advocacy, I will talk about this initiative that I have. I haven't got a foundation yet, but I said, I'm not going to wait till I have everything in place before I can advocate for support from people. So it is just to support, to commit your finances to supporting women who are not able to even complete their treatment. Currently, I have people who are not able to even pay for investigations to even continue in the next phase of their treatment. And you know, cancer waits for no person. Once you start the treatment, it also gets angry when you are not attending to them. It begins to be rapid and grow faster. So but that is just something small about the Support a Sister initiative. You can get my contact from Dr. Van Dyck. I'm open, and I'm just starting this thing. I don't know how far I'm going to go, but I hope to go far with it. I hope to hook a lot of women onto this so that they can also benefit from it. So as a wellness center, I'm just putting this plea across, if it's possible, to also support me. I don't know how I'm going to do it, but just support me to also help other women to solve their financial need, because we need people to thrive. Imagine many people have thrived because like myself, we get a lot of advocates out there to help more people, and together we can. So that's just something small about my Support a Sister to Thrive initiative. Thank you.
Okay, so I don't know whether Abigail can hear me, but in
Hello?
order to, yes.
So I was trying to put Elsie's contact in the chat so that people will see, but I will do that in the course of the discussion. So Doctor, I think you should take over, and then afterwards we may take questions concerning what Elsie shared with us.
Thank you, and good evening to everybody. Elsie, kudos on sharing your very inspirational journey, and thank you for partnering with us on this educational campaign as well. God bless you, and may He continue to give you the strength. Amen.
Amen.
All right,
Amen.
so I'm going to do a presentation on empowering informal caregivers, building a strong support system. Please let me know if my slides are in slideshow, please?
Yes, it is. Thanks.
Okay, thank you. So I will turn off my video so that I can preserve some data, but then when it's time for Q&A, I can turn it on with permission. Thank you. All right. So this is going to be my outline, a brief, very, very brief overview about breast cancer, the challenges that breast cancer patients face, and then we will talk about informal caregivers and the challenges that they have and how we can empower them. We all know breast cancer is a disease that predominantly affects women. But the fact remains that we also have a few men. If you take 100 breast cancer patients, one of them, at least one of them, will be a man. And worldwide, breast cancer has been associated with causing a lot of deaths in women. In about 95% of countries worldwide, breast cancer cases have been reported. So if you take the whole world, it is the second leading cause of death. But if you just want to know the people who have cancer generally, without necessarily being the leading cause, it is the #1 cause of a cancer diagnosis in women worldwide. And I put this picture in just to refresh our memories about the fact that breast cancer develops in various areas in the breast that we may not see with our eyes. It is usually hidden. It's only a few times that you can actually see some changes on your skin or on your nipple. But most of the time, it is microscopic changes that are taking place inside the milk ducts and the lobules that produce milk inside the breast. So the statistics about breast cancer talks about the fact that most of the time, especially in Caucasians, they tend to have more breast cancer diagnosis than in sub-Saharan Africa. However, when you compare the people who die from breast cancer compared to the Caucasians, you realize that the survival rate for people in a country like the US is about 80 to 95% compared to about 20% in countries like Ghana. And it's mainly because of late diagnosis and coming in at an advanced diagnosis as well. Apart from the fact that in other countries, especially the European countries and among Caucasians, where you have the breast cancer occurring in white elderly people, in Africans, we are seeing the diagnosis occur in people who are relatively younger, before menopause. So we need to all be aware that although it tells you that with advancing age, there's an increase, however, we still see people in their 20s, in their 30s who come down with breast cancer. And these are the signs that you can see. So how do we make a diagnosis? I'm doing this overview so that we know how important informal caregivers are needed, because somebody might see changes on their breast. They might see a lump on their breast, a nipple which is being retracted inside. And they just need somebody to encourage them, although there is that possibility that it can be a confirmed case of breast cancer. That time from when they notice the lump to when they start the investigation is quite crucial. And sometimes it is informal caregivers who help patients to present early than the patient themselves would if they were making those decisions themselves. So before we make a diagnosis, when you come and you have already noticed the lump yourself, or it is picked up during clinical breast exam or during campaigns like this one that we are having, we need to do a full exam looking at the size of the breast, comparing it, any nipple discharge, any change in the breast. And after that, you do certain maneuvers, and then they conclude whether you need to do further tests. However, for people who are even above 40 years, when you don't feel anything in your breast, we recommend doing a mammogram as a way to pick it up early, at an early stage, so that even before your fingers are able to pick up the lump, it can be picked up through the mammogram. So this is a clinical examination taking place in a hospital. So as part of the diagnosis, we have to do ultrasound, we have to do the mammogram, you have to do a biopsy. And all these cost money. Madam Elsie has already talked about how the fact that she had her employers who covered all her costs, but people who may not have employers or have sustained health insurance may not be able to cover this cost unless some relative or some informal caregiver is concerned enough to offer them some financial assistance if they are not in a position to support themselves. So these are the investigations. So breast cancer treatment. When people have now gone through the phase of the diagnosis, confirmation that it's a cancer, it now has to be treatment. And at this stage as well, we need the caregivers. And there are a number of factors that are considered before they decide that this person will need chemo, this person will need surgery, this person will need radiation therapy, and this person will need hormonal therapy after treatment. And so it is not a one-size-fits-all. And these are the treatment options. And importantly, as informal caregivers, we need to remember that the complications come when you decide that you don't want treatment, you decide that you want to do herbal or you want to do something else. And I mean, sadly, in the past couple of weeks, I've had elderly women who the diagnosis was made maybe more than a year, and for one reason or the other, they refused either chemo or they refused surgery or even biopsy. And so as informal caregivers, we are really crucial. So should you have a relative or somebody who is having a challenge making that decision of that crucial step of whether they want to come to the hospital or even initiate treatment, please do not accept it. Let the person, give the person the option of speaking to counselors in various hospitals attached to teaching hospitals or cancer treatment centers, just so that whatever their fears or concerns are, it can be addressed so that treatments can be offered to them in a timely manner. The other complications, as Elsie mentioned, after you've done your mastectomy, where they remove the breast, sometimes they take out the lymph nodes, and it can also lead to the swelling of the arms. In a few people, it might persist, and you may need to wear some tights as well. So in a nutshell, this is an overview of breast cancer, but Madam Elsie has shared her breast cancer journey with you. So I'm just going to gloss over this. So sometimes, even before the diagnosis is made, you visit the hospital, you do your biopsies, you do your lab test, and the anxiety whilst you are waiting for the results. You need somebody to help you when you haven't even been confirmed that you have breast cancer. And most of the time, it may not be a clinician. In Madam Elsie's case, she was fortunate enough to have professionals who also served as caregivers beyond their formal role that they played. But a lot of people rather rely on informal caregivers, and along the line will appreciate clearly who the informal caregivers are. So there's a confirmation of a feared diagnosis. This is a problem. Decision to do additional tests, timeliness to do them, when to do them, money to do them. And then everybody has got different recommendations, as we have seen in the previous slide. But additionally, after surgery, depending on the person's health condition, they may not be able to handle their wounds themselves. When they are going through challenges of chemo, they might need additional help, which may not be something that will formally be provided in the healthcare situation. And in the case where there's advanced disease, they definitely need caregivers in the home to help them as well. So I'm briefly going to tell you about 3 patients. They've been anonymized, but these are their journeys that they experienced. Madam AA, she was aged 45 years. She's aged 45 years. 3 children aged 9 to 16. Her menarche was unknown. She was diagnosed with breast cancer, started with treatment and defaulted. And her reason is unverified. Unfortunately, it didn't end too well. But what she reported, or what I was told, and this was unverified, was that healthcare workers were stigmatizing her in a quasi-government institution whenever she went for chemotherapy. And so she resorted to herbal medicine. And in her case, there was a husband's company that could have footed her bill. And so orthodox medicine was not a challenge. When I first saw her, she was already in coma. IV access was a challenge. She had a wet dressing around her left breast, and she died a week later. And for somebody like this, assuming the condition was even advanced and the person was not comatose, we have treatments or therapy where we give palliative care to improve the quality of life of people with advanced disease. And so even when somebody comes and they are told the disease has spread, there's still something that can be done to help make the person more comfortable and make their journey tolerable rather than a painful journey. So that's the first patient. So this is an example or a summary of somebody's journey. The next patient is Madam Cici. She, 43 years old, single mom of a 6-year-old. She noticed the lump 1 year before she presented. So, like I said, most of the time, the lump is picked up and a decision to show up to the health facility is crucial. Studies have shown that people delay in reporting. They see a lump and some people can wait as long as even up to 3 to 5 years before they decide that they want this done. And sometimes patients also even keep the discovery of a lump to themselves. And so elderly women, if you have elderly mothers or aunties that you have conversations with, these are something that we should be asking them, because sometimes because of the fear that it may indeed be breast cancer, they actually conceal the fact that they have noticed a lump in their breast. Or sometimes when people notice the lump in their breast, they are hoping that it will go away. They've waited 1 month, it's not going away. They are still not showing up to the health facility. And then it moves from 1 month and then it becomes a year. So this is an example of somebody in whom the lump was noticed. So she presented, so this particular patient, again, I was contacted by her sister-in-law, and her sister-in-law was a nurse. And what she told me was, we want the lump removed. So it was more or less like she, the sister-in-law, her husband, who is a brother to Madam CC, all together now decided that this lump was removed. And I don't know whether they knew already that the lump was there, but when they found out, they all said they wanted the lump removed. And these are, I mean, there's a formal caregiver as well as an informal caregiver involved. So eventually she shows up. She did an ultrasound scan, and just like in Madam Elsie's case, the first ultrasound scan said it was a BRAF2, suggesting that it was unlikely to be malignant. So then she was asked to go and have a biopsy. And because everybody has said now we want the lump removed, she was also well prepared to have the lump removed. Fortunately, when she presented to the facility to have her lump removed at the primary care level, there was a nurse in charge, and I always compliment her for that. Once she realized that the patient was above 40 years, she said no, they were not going to have this excision biopsy at our level. But then she was referred to go into the teaching hospital to have a broader examination done. And so she went to the teaching hospital, and the lump was confirmed, and they booked her for a biopsy and told her to go home and they will call her. 4 weeks down the line, she was never called, but through her own initiative and also through the help of a nurse, her sister-in-law who was a nurse, they decided to go to a private clinic, and the core biopsy was done, and it confirmed that it was a grade 2 invasive cancer, ER positive, PR positive, and HER2 negative. These are hormones which sometimes when they are positive, it helps the response. And it's been known to have better prognosis. So when you are triple negative, that is ER negative, PR negative, and HER2 negative as well, it's quite challenging sometimes to have a cure. So before they decide that this is the treatment you are going to get, they then have to do what we call a metastatic screen. You do a chest CT scan, you do ultrasound of your abdomen. I think even now they are doing a CT scan of the abdomen as well to find out if there is any metastasis. Unfortunately, although the lump was a small one in her breast, it had already spread to her lungs and her abdomen. So she was referred for radiotherapy, and also the palliative team was involved. So radiation therapy recommended some medications for her. And I saw this patient beginning of January 2023, and she's doing well. The third patient, also not a fictitious patient, age 38 years, married with 2 children and 4, age 2 and 4. She's very well educated, and she had a history of ovarian cancer 15 years prior, and she does her breast self-exam regularly, and she found a right breast lump, which 5 years prior, they had said it was benign. Then in her dream, she dreamt that she had a left breast lump. After she had a dream, she did a breast ultrasound, and they said everything was fine. But she still wanted a second opinion. I guess sometimes God speaks to us in dreams. So she sought a second opinion, a mammogram and a breast ultrasound was done, and a left breast lump was discovered in her breast axillary tail. So the breast axillary tail is almost like you are going into the armpit. So maybe that's how come the first sonographer missed it, and they classified this as a triple negative cancer. She did her metastatic screen where they did the chest CT scan and ultrasound of the abdomen, and everything was normal. So she, being very well educated, she decided to have a bilateral mastectomy done. And interestingly, this time the patient wanted the bilateral mastectomy, but caregivers, friends, family members were trying to discourage her, but she still went ahead and did it. And she's also doing well. So we are now going to look at some of these obvious challenges that we see and how the role of caregivers is important. I put this logo here because that is the campaign that Global Outreach is currently doing, trying to destigmatize breast cancer, have the conversation of breast cancer all year round beyond October. So Madam Elsie mentioned some of the challenges that they face: emotional, psychological, physical, and practical challenges, anxiety and fear, depression, body image issues. So Madam Elsie is quite resilient, but not everybody may be as resilient when they see their hair is being lost. They might start having body image issues, and they might even lose their self-esteem. Some people may feel isolated. And also the idea of whether even the therapy you've gone for is going to actually cure you. The uncertainty can be quite challenging. And some people feel guilty because whilst they are going through these challenges, their loved ones around them have to take up some of the roles that they used to do, and they feel guilty that if they were not sick, all this would not have happened to their loved ones. Anger, coping with the role changes. You are the one always in charge, you are the one picking up the kids, you are the one doing so many things, and suddenly you cannot do this. Assuming you were in this state, it will be challenging. And so people who go through this need the appropriate support. Psychological challenges, always thinking, will the cancer come back? Will the cancer come back? And even when you have accepted to go through the treatment, sometimes the treatment itself can also give you some side effects as well, where whilst you're going through the treatment, you might have loss of concentration and some memory gaps as well. Some people also go through identity crisis and an existential distress. Some people might actually turn away from their maker out of anger and frustration. And some people, that might also be the time where they draw closer. There's a risk of social withdrawal, adjusting to treatment. And so some of these things cannot always be addressed medically. And that is where the informal caregivers come in. Assuming some people have families that are supporting them, but it can also lead to strenuous relationship just because now your husband, who should have been providing you with the necessary care as an informal caregiver, appears to be disinterested or even reject their wives because of a breast cancer diagnosis. And assuming you were in a cohort who are all going through treatment and you have survived and others have not, there is also what we call survivor's guilt. Post-traumatic stress and decision-making stress as well. And that is something that in Ghana is a big issue. The issue of losing their breast, the issue of cutting and losing their hair. These are issues that should be dispassionately discussed, and we need to validate these emotions and not brush them aside, especially as healthcare workers, in order to ensure that the needs of women are addressed, just to encourage them to make the right decisions and also in a timely manner. Physical challenges, the side effects of surgery, side effects of radiation, side effects of chemo. A lot has been said. Lymphedema, which is the swelling or the accumulation of fluid, has also been talked about. Getting tired easily, such that you've completed your chemo, but then the strength to even do your daily activities of living, bathing yourself, eating, it can be difficult. And so you need informal caregivers to help you in situations like this. Some people are also at risk of bone density loss because of the treatments, and the hormone changes, the therapy that you get, it can let you have some hot flashes, mood swings, and changes in your libido. Chemo can also cause neuropathy. This is what we call in our local parlance, anansi, where you have some pins and needles. It goes after a while, but sometimes it can be so bad that they can't walk, or whenever they walk, they're in so much pain. You need caregivers here, especially if you are experiencing such things at home. There might not be a doctor or a nurse to assist, but it's relatives and friends who will help you. Weight changes, sleep disturbances. Now the practical challenges. Madam Elsie mentioned it. You have the desire to start therapy. Unfortunately, you don't have the money. Or somebody has offered that come to the health facility, I will make sure I organize something for you. And even the money for transportation is unavailable. Or even the healthcare coverage in terms of national health insurance, it covers some extent of the treatment, but there is also a significant aspect of the treatment which is not covered, especially the diagnostic imaging, etc. And trying to balance the scheduling. They tell you, come back in 1 month, come back in 1 week, do a test, come back, etc. All these are just written on a piece of paper for you to do. Whether you can afford it, whether you have the time, whether you have people to bring you, is not something that is often discussed, and it's a practical challenge for most people. Workplace issues. We thank God for Trust Hospital and what they really did for Madam Elsie. But in some workplaces, they are not so kind. And you actually end up losing your job because you are trying to get help. Childcare and family responsibilities. And the challenge to cook, challenge to clean, challenge to shop. And these were all things that you were doing. But because of the diagnosis, either the treatment you are going through or the effects of the treatment, you may not be able to attend to these practical challenges. What you feel like eating, you have to make a lot of out-of-pocket expenses, and you really need social support and emotional support as well. So we've been talking about informal caregivers, informal caregivers, informal caregivers. And I'm sure by now we should have an idea who informal caregivers are. These are relatives. It can be your partner, it may be a friend or a neighbor, somebody who has a relationship with a person or a patient they are caring for. Unlike formal caregivers where patients come to the health facility, you do not know the patients from anywhere, especially if that's the first time you are seeing the patients. But informal caregivers tend to most often have some kind of connection with the patients they are helping. And it's not only in breast cancer, in all conditions where there's some kind of disability or a chronic condition, which requires some help beyond what is provided in the healthcare facility. And informal caregivers can also work with formal caregivers and other family members. So we have informal caregivers, which it can be full-time or even part-time. You may be living with a person, or you may be going to your own home and coming back to help the person. And you decide with the person based on your convenient time that this is what I can do for this person at this particular point in time. And if you're a partner and you still have to go to work, it might be challenging because now you have to try and balance supporting your partner who is going through treatment and at the same time taking up some of the roles as well. The truth of the matter is, a lot of times, many informal caregivers are not compensated most of the time. And most of the time, they try to do this voluntarily. So there was a study or some information I saw online which commented about the fact that worldwide, we have as many as 50 million unpaid informal caregivers worldwide. And they are all taking care of chronic patients, relatives, neighbors, and they are doing this voluntarily. So do these informal caregivers really have a role? I'm sure by now you appreciate that they do have a role. Take, for instance, the need for emotional support. They give a listening ear that healthcare professionals may not be able to give you more than 30 minutes, more than 1 hour, but these informal caregivers are available, helping you to cope with the challenges of your diagnosis. And they can help you reduce the feelings of isolation and anxiety, knowing that you haven't been stigmatized and people still care for you. They provide physical assistance. They take up those challenges that the breast cancer patients can no longer take. They can also play advocacy role. They come to the healthcare facility with their patients. And unfortunately, in a lot of our public health facilities, you can't come to the health facility without a relative, even when it is not a cancer diagnosis. Because you come and they tell you, go here, go and pay this year, go and do this year, go and do this year. And in situations where people are going through the healthcare system with a cancer diagnosis, already trying to balance this whole new thing about what will happen to me. And you still have to come into the system and deal with, go here, go here, go here. So if you have somebody who plays that role for you, it's really helpful. In Ghana, for instance, where health literacy is low, it means you may need people who are relatively more educated in families to break down the message for patients who may not be so literate. Because even if we have literature, which you give to them, they need to appreciate it. And people need to break it down in people's local languages so they can do that. In the absence of this in healthcare facilities, informal caregivers take up this role. You go back home and you are told when you see these side effects and it becomes too much, report to the health facility. It is these informal caregivers who are going to help you do the monitoring and also help you go back to the hospital. They will help you to manage your appointments. Sometimes you are so tired, they tell you to return in 2 weeks or 3 weeks. It's coming up, you don't feel like going. It is an informal caregiver who might help support you. They can also help look for financial assistance for you if they themselves are unable to provide financial assistance. They might rally relatives, neighborhoods, churches, etc. to help you do that. But informal caregivers themselves face challenges because of the burden. As many as 50 million people worldwide providing, in quotes, free care, they will definitely have some challenges that they go through. They themselves might undergo some kind of emotional stress, anxiety, and depression because it is assumed that you are well enough and so take care of this person who currently is unwell. And so during that period, you end up as an informal caregiver, if you do not have it at the back of your mind to make sure you are taking care of yourself, you might become emotionally stressed. Physically, you can also be exhausted. And if there is an increasing reliance on the care that you provide, then it becomes a challenge for you to have a normal life, in quotes. Your work might be affected. Your social commitments might also be affected. And we even have children as informal caregivers in some households as well. And in such a situation, such children may lose work. They will not be able to go back to school, or they will lose their hours in school. And that might be a challenge for them. Financial impact. A lot of times there is lack of support. And I'm sure all of us have heard of stories where you have about 5 siblings, the mother or the father is sick, and it's only maybe 1 or 2 siblings who are providing the necessary care, and the others might be providing financial support and think that once financial support is being provided, that should suffice for those who are actually physically present, and it can be difficult. Knowledge gaps, assuming there are certain aspects that you are not a healthcare worker and you are supposed to provide this care, it means you yourself need to better understand it before you can even provide it to the patients you are caring for. And it can provide some kind of uncertainty in your role as a caregiver. So there's what we call role confusion. Navigating the shift in the relationship dynamics can be challenging, especially when moving from family member to caregiver. So you are a sibling, a sister, an aunt, a daughter, and before the diagnosis, you were just a relative. Now you are more or less considered as the person who is providing care in the house. And that can also be challenging because when you feel tired and stressed, who will hear you out? Because it is not a job, in quotes, and most of the time they feel neglected, they feel burnt out, they feel lonely, socially isolated, and sometimes they face tough decisions about the medical care and living arrangements, and it can be very, very overwhelming to them. So how do we empower them? I'm sure all of us at some point in time have played a role as informal caregivers when we're taking care of our children. However, if you are taking care of a relative who needs more than 3 days of care or 5 days of care, but somebody who needs months and years of care, and especially if it is unpaid and nobody is having that conversation about whether you should be paid, what is going on in your life, everything has halted in your life because you are taking care of a relative. We need to think, and I'm happy it is KNUST that is doing it. It's an academic institution. We should think about ways of formalizing some kind of education and training, because it's an area that we often do not talk about. Offering workshops to help caregivers, especially the educated ones, and find a way to also reach those who may be uneducated through using people who come into the hospital who are more or less coming with relatives, and ensure that caregivers are confident and are also competent, so that people are not so frustrated to the point where they can rather start causing harm to vulnerable patients. Access to resources. So in Ghana, unfortunately, we do not have a lot of foundations that support these kind of challenges. And so I'm happy that Elsie is taking on this initiative, and we can have further discussions with other corporate entities and see how they can also come on board and support. But we have survival groups. We have places where we should start thinking about how we can formally create avenues where people who are providing care can have some kind of respite. It is quite formalized in other countries. And a lot of the time is because healthcare also pays for home visits by healthcare workers. And so sometimes you can have the National Health Trust sending carers to somebody's home to relieve an informal caregiver. Or sometimes they take out these patients into a place, and then there can be some kind of a break from care, and it is even scheduled and it is formalized. We also need to provide emotional support to the caregivers. We need to help them, hear them out. And as family physicians, we tend to learn how to do this better, where we not only address the issues of the patients, but also are interested in the patient's relatives as well as people who are providing care. And as a society, when somebody is taking care of relatives, we should be more than willing to come on board, as Trust Hospital did. And it's quite, it's worthy of emulating. And it's something that should be published or publicized so that other companies can do so when their workers are going through the same situation. And this will definitely help people who are providing care, so that the fear of losing one's job is not present. Financial support is very, very important, as has already been mentioned. But importantly, we as healthcare workers and also people in society, if you yourself know somebody who is an informal caregiver and the person is having challenges, we have what we call self-care practices, where the people are directed to the psychologist to help them go through some stress management techniques. Have a frank conversation if you are more than one sibling and it appears that you are the only one taking care of your mom. And sometimes if there are relatives abroad, the conversation of having somebody other than a relative, you can also pay for nurses, home care nurses, so that there is that respite or demand on the time and attention for you as an informal caregiver, providing care to your relative who is going through difficulty. And when somebody is telling you about the stress they are going through as an informal caregiver, we need to understand it. Let's not brush it aside. Let's have more campaigns about the fact that there are people who are going through these challenges. And I dare say we all have heard stories of how one relative or the other, maybe a wife or a daughter or some other relative, is looking after a sick relative for years or months. And sadly, that person who is providing informal care ends up dying, and their relative they were taking care of is also left behind. And that becomes a big challenge. So let's promote advocacy and let's ensure that if it is becoming a real problem in terms of some kind of abuse where people who do not have a say are the ones who are providing this care and they are not being paid. And so I hope after this conversation or this webinar, we will all become advocates for informal caregivers and ensure that we ourselves, when we play that role, we will ensure that we do not fall victim, or we know what to do when the challenges arise. So I put this up here just to publicize the breast cancer campaign we are doing currently, Bisayen Ask Us and Touch Us breast cancer educational campaign. And as part of the campaign, we have a helpline where people who are having challenges navigating the healthcare system can call, or anybody at all with questions on breast cancer can also call. And these are our social media handles. And I just wanted also to share that Elsie's survival video is on our channel on Global Outreach Consortium on YouTube. So anybody you want to share Elsie's story with, you can just go to the Global Outreach channel on YouTube and share it to people so that they are encouraged. I want to thank you so much for your attention. Questions, comments, contributions, all are welcome. Thank you so much.
Thank you so much, Doctor. Thank you too. You are so much welcome as well. This is very, very enlightening. Most of the time, we only hear of the particular screenings you need to do, the things you need to do to prevent yourself, and all that. And today we have something different. We have learned a lot about people that take care of these patients and the things they go through. And we have also heard Elsie's story, a survivor, and all that she went through. We want to say thank you so much. Once again, I want to remind all of us that this webinar is brought to us by the kind courtesy of KNUST Wellness Center in collaboration with Global Outreach Consortium. And as we are talking about this breast cancer thing, we want to be sure that we are all taking care of ourselves. And if not, that's why KNUST is here. We are here to take care of your physical, your mental, your psychological, and every well-being you need to be assured of. So we are here on KNUST campus. We are close to the poolside, adjacent the poolside. Come in each day. We have our dietitians, we have our psychologists, we have the gym, all available to you. And I want to be sure that you pass by one of these days. So we want to have a few minutes to have questions, if you have any, from any of the attendees. If you have a question, kindly raise your hand. Use that raise your hand icon to ask your question. We are leaving about 5 minutes to do that. If you have question for Elsie, who shared her story, and then if you have any question for Dr. Vandyck, the time is now. Hello?
Please, I can see 2 hands raised.
Thank you very much, Madam Elsie. I want to find out from you, when you were told you had the cancer, I perceive that there was an overactive inner critic that speaks to your head, a voice that perhaps you are going to die, this is a terrible situation, and so forth and so forth. It happens to all of us when we go through crisis, and in the night, whether there are caregivers, they will be there, they are gone. But inside us, we hear this inner critic who is dealing with us and dealing with us and dealing with us. How did you overcome this inner critic who are called a voice that tells you you are going to die, you will not survive, judges you, and all those things? Please, how did you do that?
Okay, thank you, Mr. Odru, for your question. In fact, I would check all the questions you asked. I mean, I just fit into all of them. So I was afraid initially. Like I said, I was afraid. I began to cry, and I knew I was going to die because we all know that cancer means death in this part of the world. So one, fear was there. Two, death was also on my mind to the extent that I said, if I had like 6 months to live, it was enough time to reconcile with my maker and to prepare for my death. It's better than dying out of poison or accidents or anything. In fact, I really got that low. And I remember in 20, and I think in the National Science and Maths quiz that year, when Keta was in the semifinals, we were all happy at home. Then this voice came. Don't you know that you have breast cancer? You know, then I just brush it off. Okay, so that voice actually came. It didn't come in the night, it came in the evening. And at another time, it came in the afternoon. And the voice said, you are here. Don't you know you have breast cancer? At that point, I told myself that I have to really drive all those negative thoughts away from me. Then I began to rather speak the promises of God upon my life, that I am a child of God. By His stripes I am healed. I am in Christ, and nobody can attack me. If they can attack, those kind of things. So those things come to, but you have to be prepared to really ward off all those thoughts that come to, because negative thoughts are like birds. Okay, once you allow them to settle in your mind, they're going to form a nest, lay their eggs, and make their family. And now you can't do anything about it. So there and then, I just had to just clear my mind and rather fill those spaces with the promises of God. So when those negative thoughts come, I use the word of God to just counteract it, and I was good to go. So it is very important that we all have that a positive attitude towards life, irrespective of the negative news that we hear. I also learned in my journey that negative news happens to all of us, but it's how you handle it. That's how it become a negative or positive. To me, it was a negative news, but by the grace of God, it had turned out for my good. That it had given me more platform than I thought I would have with my former husband. Yes. So that is how I was able to fight that negative thoughts that came to me. Thank you.
Thank you very much.
Please, do we have any other? Okay. So if we don't have any, okay, so I have in the Q&A section, can I have doctor's contact? So Dr. Vandyck, somebody wants to have your contact.
Oh, it's fine. Let me put it in the chat. Trying to get the chat. Abigail, if you have access, you can drop it in the chat. I'm trying.
Okay. Okay. I'm doing that right away. Okay. So in the absence of any other question, I want to say that we are grateful for attending today's session. We will be very, very happy if you could fill this form in the chat that I've put there for us. We want to have your feedback on this particular program, on this particular webinar. We'll be grateful to have your feedback. So if you have seen it, kindly copy the link and then fill for us now as we are wrapping up, or you fill later for us. We'll be very, very grateful. Once again, we want to thank you all for coming. In fact, we thank our doctors, our panelists, and then we also thank you for making it to today's webinar. We have these and many more. We have our time with a dietitian, which is every month, a webinar we have every month to talk to you about your diet. And then we also have Psych Gist, which is also a monthly webinar where we talk to you all about your mental health. You can also come in person to the Wellness Center adjacent the poolside KNUST campus, or you can reach us on phone. I've put the contact there. I have put the office line there. I see somebody's hand.
So I would want to, I have a few supports in the participants. I think I see my sister, the Shelley Oforinochu, and she was of a great help to me. Though she wasn't around, she always keeps encouraging me and always bearing me up in prayer. I would want to really thank her so much. And I think I have a few people who are here because of me. I think Doreen, and I think one just dropped off, Dr. Eugenia, something. But I want to thank my sister Shelley Oforinochi for coming to support me and also to support me during my difficult time. Thank you. And to encourage everybody to support my channel and to subscribe. Thank you.
Thank you. Thank you. Thank you so much. We also want to remind you that we are also on social media. We are on Instagram as KNUST Wellness Center. We are on X, formerly Twitter, KNUST Wellness Center as well. We also have our YouTube channel where we have all our recorded versions or replays of our webinars. So you could visit our YouTube channel, KNUST Wellness Center, and get all our replays. Yes, in the absence of anything, I would want to say a big thank you. See you next time. Have a wonderful evening to you all.
Thank you. And thank you for having me.
Thank you. You're welcome, Doctor.
Thank you.
Thank you very much.